Dr. Means.
Thank you. Good morning, Chairman Cassidy, Ranking Member Sanders, and members of the Senate Health Committee. I want to thank President Trump for nominating me to serve as Surgeon General and for Secretary Kennedy for his support. Thank you for also being willing to postpone this hearing. When I went into labor 5 hours before the hearing started in October, our precious baby boy was born on the hearing day. As a physician, I have always been inspired that the root of the word healing means to return to wholeness. Nothing is more urgent than restoring wholeness for Americans, physically, mentally, and societally. We are now the most chronically ill, high-income nation in the world. We live shorter, sicker lives than peer high-income nations. Today's children are projected to live shorter, sicker lives than their parents. We spend trillions annually on reactive sick care. Nearly 150 million Americans are on federal health care programs, and we spend $50 billion per year on research. Yet outcomes are worsening and disparities are widening. Our nation is angry, exhausted, and hurting from preventable diseases. Rates of high blood pressure, many cancers, autoimmune conditions, type 2 diabetes, mental health disorders, dementia, neurodevelopmental challenges, and youth suicide have all increased in the past 2 decades. This public health crisis is touching every American family. It is robbing our children of possibility, our workforce of productivity, and our nation of security. It strains our federal budget and dims hope for millions. We must confront this epidemic through a vision grounded in science, dignity, shared humanity, and a respect for freedom, not politicization and division. Public health leaders must address the evidence-based, modifiable drivers of chronic diseases, which include ultra-processed foods, industrial chemical exposure, lack of physical activity, chronic stress and loneliness, and over-medicalization. I've been asked to help our nation get healthy and answer the call of millions, especially mothers, who are begging for transparency and support. That is what I'm here to do. I believe that every American shares a core yearning to thrive and help their families thrive. But we are asking people to make healthy choices in environments that are squarely structured against them. Good policy and education can make health easier, more affordable, and more accessible. I know our current leaders at HHS and across the federal government are committed to the ambitious policies outlined in the MAHA strategy released last year that focuses on advancing research, aligning incentives, increasing public awareness, and fostering private sector collaboration to end the chronic disease epidemic. Specific efforts are already underway to fund and promote more whole, healthy food for Americans, address financial conflicts of interest in our agencies, fund research focused on disease prevention and reversal, and make institutions accountable to measurable health outcomes for all Americans. President Trump and Secretary Kennedy have invited a mature, candid, grand conversation about how our medical education and fixing perverse incentives can pull us back from the brink, and for this I am profoundly grateful. My professional history has prepared me to meet these very complex times as an innovative, unifying, and practical leader focused on reversing chronic disease. Over the past 15 years, I have treated thousands of patients in clinics and operating rooms. I have run my own medical practice and co-founded a health technology company that empowers individuals with metabolic health data to address blood sugar dysregulation, a problem now affecting over 50% of American adults and 30% of teens. In this role, I recruited leading researchers from Yale, UCSF, Brigham Young University, Cleveland Clinic, and more to support this effort. And the company launched a 10,000 participant academic industry research collaboration on early metabolic disease detection. I've held biomedical research positions at the National Institutes of Health, Stanford University, New York University, Oregon Health and Science University, and published this biomedical research in leading medical journals. I was recruited as a faculty course director at Stanford University, where I taught undergraduate and graduate students on nutrition and health. I have served as an associate editor of an international medical journal focused on prevention and disease reversal. I have spoken internationally on chronic disease and wrote one of the most successful health books of the decade, outlining a vision for reversing this epidemic through personal empowerment, culture change, and policy reform. I graduated from Stanford University with honors and from Stanford Medical School, where I was inducted by unanimous faculty vote into the Honor Society for Patient Care. In conclusion, mental and physical health are unraveling from shared root causes that we can fix. Preventable heart disease, our #1 killer in men and women, is emblematic of a nation with a broken heart. Diabetes, representing cellular energy collapse, is draining our human potential. Dementia, depression, and neurodevelopmental decline reflects a society losing its mind. Our bodies are telling us this current path is totally unsustainable. There is another way, a path that unites rigorous science with reverence for our miraculous bodies and planet and brings Americans and our medical institutions together around actual healing and prevention. This path is also economically sound, with the potential to save trillions of dollars annually. As I sit here in the early months of motherhood, I feel profound awe at the privilege we have as adults to create a better world for future generations. And that is why I'm here. As Surgeon General, I would call on every American and the Public Health Service to join in a great national healing, one that halts preventable chronic disease, makes healthy living the easiest choice, honors the body's connection to the environment, and puts America back on the road towards wholeness and health. I look forward to answering your questions. Thank you.